Sickle cell disease. It is a hereditary hemoglobinopathy. Sickle cell disease is a hereditary hemoglobinopathy. A hereditary hemoglobinopathy. Mode of inheritance is autosomal recessive. Mode of inheritance of sickle cell disease autosomal recessive. It is a hereditary hemoglobinopathy. Genotype homozygous form. Autosomal recessive, genotype homozygous form, genetic alterations, substitution of the valine for glutamic acid at the sixth position of the beta globin chain forms sickle cell hemoglobin, that is HbS. Substitution of the valine for glutamic acid. Substitution of valine for glutamic acid at the sixth position of the beta hemoglobin chain forms the sickle cell hemoglobin, that is HbS. HbS is sickle hemoglobin. Substitution of valine for glutamic acid at the sixth position of the beta globin chain forms the sickle hemoglobin, that is HbS. Predisposing factors: decreased intracellular pH, decreased intracellular pH, intracellular dehydration, inflamed vascular beds, microvascular beds with slow transit time. The predisposing conditions for sickle cell disease: decreased intracellular pH, intracellular dehydration, inflamed vascular beds, microvascular beds, inflamed vascular beds, microvascular beds with slow transit times. The predisposing factors for sickle cell disease are decreased intracellular pH, intracellular pH will become intracellular dehydration, inflamed vascular bed, microvascular bed with slow transit time. The predisposing factors for sickle cell disease: decreased intracellular pH, intracellular dehydration, inflamed vascular bed, microvascular bed with slow transit time. Pathogenesis: deoxygenation favors sickle hemoglobin formation. Deoxygenation favors HbS formation. HbS polymerizes into long stiff chains, then deform RBCs into the sickle or holy leaf shape. The HbS polymerize into long stiff chains. HbS polymerizes into long stiff chains that deform the RBC into sickle shape or होली लीव्स शेप. HbS के पॉलीमराइजेशन के कारण RBC का शेप सिकल शेप्ड हो जाता है या होली लीफ शेप. सिकल और होली लीफ शेप्ड RBCs. Repeated cycles of deformation of the RBCs causes irreversible damage to the membrane, leading to non-deformable RBCs with permanent sickle shape. और ये अगर इसका रिपीटेड साइकिल्स हुआ, दैट इज़ HbS का पॉलीमराइजेशन के कारण रिपीटेडली अगर वो डिफॉर्म हो रहा है तो रिपीटेड साइकिल्स के कारण इरिवर्सिबल डैमेज होगा. रिपीटेड डिफॉर्मेशन के कारण इरिवर्सिबल डैमेज होता है मेम्ब्रेन को, लीडिंग टू नॉन डिफॉर्मेबल RBCs. Irreversible damage to the membrane will lead to non-deformable RBCs with permanent sickle shape. ठीक है, तो रिपीटेड साइकिल्स के कारण इरिवर्सिबल डैमेज होगा और परमानेंट सिकल शेप हो जाएगा आरबीसी का. सिकल सेल्स अंडरगो हीमोलाइसिस कॉज अनीमिया. और ये सिकल शेप्ड आरबीसीज जो है दे विल अंडरगो हीमोलाइसिस कॉजिंग अनीमिया. सो पैथोजेनेसिस: डीऑक्सीजनेशन के कारण HbS का फॉर्मेशन होता है. HbS पॉलीमराइज करता है लॉन्ग स्टिफ चेन्स में, ठीक है, जिसके कारण जो RBCs है वो डिफॉर्म होगा. इट विल बिकम सिकल शेप्ड और होली लीफ शेप्ड. रिपीटेड साइकिल्स ऑफ डिफॉर्मेशन के कारण इरिवर्सिबल डैमेज होगा मेम्ब्रेन को, ठीक है, जिसके कारण नॉन डिफॉर्मेबल आरबीसीज बनेंगे विथ परमानेंट सिकल शेप. सिकल शेप्ड आरबीसीज will undergo hemolysis causing anemia. Clinical presentation of sickle cell disease: chronic hemolytic anemia with gallstones. Chronic hemolytic anemia with gallstones, impairment of growth and development, vaso-occlusive crisis, that is pain crisis. Vaso-occlusive crisis or pain crisis is the major cause of morbidity and mortality. Severe pain in the affected region: bone, lung, liver, brain, or penis. Severe pain in the affected region. Example: acute chest pain, priapism, strokes, hand foot syndrome. Acute chest pain हो सकता है, priapism, stroke, hand foot syndrome can be there. Acute chest pain, priapism, strokes, head foot syndrome. Aplastic crisis with parvovirus B19 infection worsens anemia. Aplastic crisis with parvovirus B19 infection, it worsens the anemia. Aplastic crisis with parvo B19 infection worsens the anemia. Sequestration crisis with intact spleen causes splenomegaly. Sequestration crisis with intact spleen may cause splenomegaly. Splenomegaly is seen in early childhood, but adult manifest autosplenectomy. Splenomegaly is seen in early childhood, but adults manifest autosplenectomy. Increased risk of infections with streptococcus pneumonia and H. influenzae. The clinical presentations are chronic hemolytic anemia with gallstones, impairment of growth and development, vaso-occlusive crisis or pain crisis, which is the major cause of death, which is the major cause of morbidity and mortality. Severe pain in the affected region: bone, lung, liver, brain, penis. Example: acute chest syndrome, priapism, strokes, hand foot syndrome. Aplastic crisis with parvovirus B19 infection versus anemia. Sequestration crisis with intact spleen may cause splenomegaly. Sequestration crisis with intact spleen may cause splenomegaly. Splenomegaly is seen early childhood, but adults manifest autosplenectomy. Increased risk of infection with streptococcus pneumonia and H. influenzae. Investigations: CBC, low hemoglobin and elevated reticulocyte count. Low hemoglobin and elevated reticulocyte count. CBC shows low hemoglobin, elevated reticulocyte count because it is a hemolytic anemia. So reticulocyte count will be elevated, hemoglobin is low. Peripheral smear में RBCs are sickle cell, narrow and elongated red cells, narrow and elongated red cells with one or more ends pointed. Sickle cell means narrow or elongated cells with one or more ends pointed. Target cells and Howell Jolly bodies. Howell Jolly bodies are small nuclear remnants. CBC shows low hemoglobin, elevated reticulocyte count because it is a hemolytic anemia. RBCs will be sickle cell. We will find target cells and Howell Jolly bodies. Howell Jolly bodies are the small nuclear remnants. Sickle cells, target cells, and Howell Jolly bodies are noted. Peripheral smear में sickle cells, target cell, Howell Jolly bodies are noted. Bone marrow is hypercellular with erythroid hyperplasia. Hypercellular bone marrow with erythroid hyperplasia. Serum bilirubin is increased. ठीक है, so clinical presentation क्या था? Chronic hemolytic anemia with gallstones. इसमें serum bilirubin is increased. Hemoglobin electrophoresis, mostly HbS with no HbA. Mostly HbS with no HbA. Prenatal diagnosis by the analysis of fetal DNA. fetal DNA के analysis से prenatal diagnosis कर सकते हैं. And sickle cell slide test is positive. Sickle cell slide test is positive. Solubility for HbS is positive. Sickle cell slide test is positive. Solubility test for HbS is positive. HPLC, that is high performance liquid chromatography, or HPLC, high performance liquid chromatography, is the method of choice for detection and quantification of HbS. HPLC stands for high performance liquid chromatography, or HPLC. It is the method of choice for detection and quantification of HbS. HPLC stands for high performance liquid chromatography. It is the method of choice for detection and quantification of HbS. So sickle cell disease is a hereditary hemoglobinopathy. It is a hemoglobinopathy, mode of inheritance autosomal recessive, genotype is homozygous form, genetic alterations. The substitution of valine for glutamic acid at the sixth position of the beta globin chain forms sickle hemoglobin, that is HbS. Predisposing conditions are decreased intracellular pH, intracellular dehydration, inflamed vascular beds, microvascular beds with slow transit time. Pathogenesis: deoxygenation favors HbS formation. HbS polymerizes into long stiff chains that deforms RBCs into sickle or holy leaf shape. The repeated cycles of deformations will cause irreversible damage to the membrane, leading to non-deformable RBCs with permanent sickle shape. These sickle cells will undergo hemolysis, causing anemia. Clinical presentation: chronic hemolytic anemia with gallstones, impaired growth and development, vaso-occlusive crisis, or pain crisis. It is the major cause of morbidity or mortality. Severe pain in the affected region: bone, lung, liver, brain, or penis. Example: acute chest syndrome, priapism, stroke, hand-foot syndrome. Aplastic crisis with parvovirus B19 infection worsens anemia. Sequestration crisis with intact spleen causes splenomegaly. Splenomegaly is seen in early childhood, but autosplenectomy. Adult manifest autosplenectomy. Increased risk of infection with Streptococcus pneumonia and H. influenzae. Investigation: CBC shows decreased hemoglobin, low hemoglobin, because sickle cell is a hemoglobinopathy. Then, because it is a hemolytic anemia, so the reticulocyte count will be increased. Peripheral smears में sickle cell target cells, Howell Jolly bodies are noted. Howell Jolly bodies are the small nuclear remnants. Bone marrow is hypocellular with erythroid hyperplasia. The serum bilirubin is increased. Hemoglobin electrophoresis shows marked HbS with no HbA. Prenatal diagnosis can be done by analysis of fetal DNA. Sickle cell slide test is positive. Solubility test for HbS is positive. Sickle cell slide test is positive. Sickle cell slide test is positive. Solubility test for HbS is positive. HPLC stands for High Performance Liquid Chromatography. High performance liquid chromatography is the method of choice for detection and quantification of HbS. See, sickle cell slide test is positive. Let's see about sickle cell slide test. Principle: when red cells containing sickle hemoglobin are deprived of oxygen, they become sickle shaped. या ये पैथोजेनेसिस है कि डीऑक्सीजनेशन के कारण HBS का फॉर्मेशन होता है, ठीक है। HBS के पॉलीमराइजेशन के कारण जो RBC है दैट बिकम्स सिकल शेप्ड। रिएजेंट फॉर सिकल सेल स्लाइड टेस्ट, 2% sodium metabisulfite, 2% sodium metabisulfite is used as reducing agent, 2% metabisulfite, 2% sodium metabisulfite is used as reducing agent, 2% sulfur, 2% sodium metabisulfite is used as reducing agent, 2% sodium metabisulfite is used as reducing agent. Positive test, sickle cell becomes sickle shaped or holy leaves shaped. The reagent was 2% sodium metabisulfite. पॉजिटिव टेस्ट में जो रेड सेल्स है वो सिकल शेप्ड या हॉली लीफ शेप्ड बन जाता है। फॉल्स नेगेटिव टेस्ट, विथ यूसेज ऑफ आउटडेटेड रिएजेंट और लो कंसंट्रेशन ऑफ HBS। आउटडेटेड रिएजेंट या अगर HBS का लो कंसंट्रेशन है तो फॉल्स नेगेटिव मिलेगा। आउटडेटेड रिएजेंट या लो कंसंट्रेशन ऑफ HBS के कारण फॉल्स नेगेटिव मिलता है। फॉल्स पॉजिटिव इज विथ एक्सेसिव कंसंट्रेशन ऑफ रिएजेंट और ड्राइंग ऑफ द वेट प्रिपरेशन। फॉल्स पॉजिटिव कब मिलेगा? विथ एक्सेसिव कंसंट्रेशन ऑफ द रिएजेंट और ड्राइंग ऑफ द वेट प्रिपरेशन, ठीक है। So sickle cell slide test is positive in case of sickle cell disease principle when the red cells containing HBS are deprived of oxygen, they become sickle shaped. Reagent use, 2% sodium metabisulfite is used as the reducing agent. Positive test में the red cells will become sickle shaped और holly leaf shaped. False negative क्यों होगा? With the usage of outdated reagent और लो कंसंट्रेशन ऑफ HBS के कारण फॉल्स नेगेटिव होगा। फॉल्स पॉजिटिव होगा विथ एक्सेस कंसंट्रेशन ऑफ रिएजेंट या ड्राइंग ऑफ द वेट प्रिपरेशन। एक्सेस कंसंट्रेशन ऑफ द रिएजेंट या ड्राइंग ऑफ द वेट प्रिपरेशन के कारण फॉल्स पॉजिटिव होगा। सो दिस इज अबाउट सिकल सेल डिजीज।